Hi everyone. So this is a sort of fast resource that is meant to cover some basics for people who either have recently gotten an Ehlers-Danlos syndrome diagnosis or hypermobility spectrum disorder diagnosis, or for people who are suspected to have hypermobility spectrum disorder or Ehlers-Danlos syndrome and who maybe aren't able to get um, into the right resources to get a diagnosis. Um, this is about top 15 things to consider for treatment and comorbidities things that are just a little bit more prevalent in these disorders and that you may need a little bit more help with and that may crop up. Now, it's a very informal resource. This shouldn't be something that you should start self-diagnosing. It's not intended to supplant medical advice, and there's and while there is higher crossover in some of the things that I'm going to mention below, um, some of the things may not be very common, just depending on what types of things that you personally are having. Some people may have, just one or two of the things listed below. Some people may have nearly all of the things listed below. It just really depends on your individual circumstances. And it's important that you're able to recognize when you're having an issue and that you're able to get the help that you need. And getting that help and getting early in primary prevention, early intervention can really help. So it may require going to different specialists. Really, unfortunately, there are not very many generalized practitioners for Ehlers-Danlos syndrome. And one of the really unfortunate things as well is that even though there are few hubs that really tried to help Ehlers-Danlos syndrome, the truth is that some of the subspecialties for this condition is that some of these specialties are really intensive specialties. And when you combine having a collagen disorder with them, it gets even more complex and the treatment can get harder to do. And you can end up with doctors who try to be a jack of all trades, but then are a master of none, and you don't really get the help that you need. So it can just be important for you to have this as a little bit of an understanding. So some of this information, it may or may not apply to some of the more rare diagnoses like vascular or classical vascular mixed or things like that for Ehlers-Danlos syndrome. And it may apply to things like just having generalized joint hypermobility and stuff like that. But regardless of whether these resources help you or not, hopefully there's some information in here that can help you get the resources and the support that you need. And this is really intended just to help medically complex patients be aware and get that kind of support. But remember, this is not intended to be in place of medical advice and is not intended to, take the place of a doctor. So don't start panicking or start self-diagnosing or anything like that. This is just to sort of help you be aware of some of the things that are more commonly reported in Ehlers-Danlos syndrome and hypermobility spectrum than in the general population. So that means when it's more commonly reported, it could mean that people report it twice as much or 3 or 4 times as much. But if it's something that only 1% of the population has, remember that even 4 times as much might mean only 4% of the population with EDS has it. So it may be something to look out for, but it may not be something that you have to panic about. It just may be something to be aware of in the back of your head that if you start experiencing symptoms, you may want to look out for. Okay. So these are in no particular order. We're going to start with number 1, dysautonomia or autonomic neurology problems. So dysautonomia is just a very vague and general term. And honestly, dysautonomia affects a very high percentage of the population at some point in their lives. One of the most common problems in dysautonomia is syncope. So that's just having an episode of fainting. So that's probably something that a lot of people have experienced at some point in time. But having also vasovagal syncope, or little like pre-syncope where you feel like you're going to faint, that can be pretty common, having autonomic problems with that. A condition that can sometimes be correlated or related to that is POTS, um, and that can be pretty common as well. There can also be the autonomic nervous system is just this really large system that essentially controls a lot of parts of the body that we don't have conscious control over. We can't just sit there and make our body do a lot of these functions. And although there are things that we can do sort of to help ourselves in our well-being with regard to our autonomic nervous system, we don't have conscious control over it. And so things like breathing, heart rate, sweating, body temperature, stuff like that. It's incredibly common for there to be some dysfunction in a lot of the different types of Ehlers-Danlos syndromes, and sometimes it can even be misinterpreted or misdiagnosed as a psychiatric disorder, because there can be types of dysautonomia that sort of present as anxiety or panic, or sometimes depression or stuff like that. And so it's really important that we know whether or not it's our autonomic nervous system that's going haywire or awry, and that we get proper diagnosis and proper treatment of these things, because good diagnosis, good treatment can be more helpful than throwing a lot of psychiatric medications or things like that if this is actually what's going on. This is not to stigmatize psychiatric things, and we'll talk about that later, but that having the right diagnosis can really be incredibly helpful and can stop us from chasing down a lot of time in the wrong sorts of roads. So it's also important because certain things like POTS, or there's like hyperadrenergic POTS or hypovolemic POTS, which are they present a little bit differently, that they can really affect our bodies over time, and especially if they lead to things like syncope or stress on the cardiovascular system. It can lead to injury, it can lead to other problems over time, and so we don't want those things to exacerbate. So we really want to ensure that we get these under control. There used to be a misunderstanding that some of these things were solely due to deconditioning or things like that, and while certainly staying as healthy as possible is great, even elite athletes can develop POTS. And so it's not really that simple, and there are a lot of treatments for this. So dysautonomia, number one. Number two on our list is cardiovascular issues. And so, as I mentioned, we want to be aware of this. So collagen is everywhere, and sometimes that can present in terms of being also in the cardiovascular system. A lot of people with these conditions can talk about having bruising, and there are serious things, and a lot of people with EDS are recommended to have their like an echocardiogram and having their hearts tested like every few years, I think is the general, like 2 to 5 years or something like that. You should check with your doctor on what they recommend. But it depends on how severe your situation is. It's more frequent, of course, if you have vascular or classical or something more serious, or if you have associated risk due to like either a comorbidity or family history or things like that. And you definitely want to have blood pressure monitoring and testing if you seem to have these kinds of risks. It's important for parents or for patients to learn about, medications that they might need or other healthy like supplements or nutrition or other ways that they might be able to manage their cardiovascular health. Um, and then there are other cardiovascular things that can be very common, like a lot of patients have issues with bruising, and they mention that it can have weird issues with their blood vessels and things like that, bleeding problems, clotting disorders, other things. And so, if you have awareness around it, sometimes it can be important, but each patient can be different, and um, there can be some ways to manage it. Sometimes it's just about knowing it and having it documented, and this can be particularly important for children or people in vulnerable populations, because if you bruise very easily, sometimes doctors or others who are mandatory reporters can see that, and they can make the worst assumptions of people, and they can believe that there's abuse happening when there isn't. And so, while we do always want to err on the side of caution when it comes to abuse, we do also want to make sure that parents and people who are caregivers are not put at massive risk unnecessarily if their loved ones are ill and have something like this. There have been many cases of this, of there being abuse allegations and stuff like that. So if you do have a high propensity to bruise, that's really great to get documented early. All right, so number 3, skin issues and dermatological issues. So essentially, to understand skin issues in EDS, it's important to understand that skin is an organ and it contains collagen. So with these collagen problems and Ehlers-Danlos syndrome, these skin problems are very common in EDS, but they can be highly variable, especially since the most common form of EDS documented right now is hypermobility type of EDS, which can come either with the weak sort of hyperextensile skin that stretches a lot, and it can come with fragile skin, or it can come with a softer, more velvety skin, but it can come with a sort of underlying set of conditions that we'll talk about in a second, but can just make a lot of issues. So some of the issues are like skin tissue weakness, atrophic scarring, skin tearing, papery skin. There can also be very velvety, soft skin, but that's still due to the collagen disorder. Poor wound healing can be a huge thing if you're having a lot of procedures or especially surgeries. Difficulty with stitches, and this can include the need for stitches to be done by a plastic surgeon, or sometimes avoided altogether depending on what type of skin issues that you have. And like I said, we are going to talk about another condition. There can also be, patients may have difficulty with adhesives and reactions on their skin, and can have a lot of things that flare up in their skin, which, like I said, we'll talk about. And so patients can have problems with all kinds of things like cysts and infections, and they can have problems with dissolving stitches not quite working properly, and problems forming around them. They can have problems with if they have band-aids or kinesiology tape put on their skin, or just things that tend to seem pretty innocuous. In most people, suddenly their skin is reacting, or like medical patches and tegaderm even, or stuff like that. Their skin can start reacting, and in some patients those can turn into more systemic reactions. And so that's going to bring to issue number 4, which is probably one of the most common issues that I think that I see patients talking about, and this is mast cell problems. So mast cells are the cells that release histamine in the body, and they're incredibly important in EDS, and they're currently being researched heavily. And so, while there's nothing entirely conclusive, um, what seems to be coming out is that there seems to be some kind of correlation between having bad collagen and having bad mast cells, and it's something that over the life course, as sort of soft tissue problems increase, so can mast cells. So somebody might feel like they don't have a lot of mast cell problems when they're younger, but as they get older, they may feel like these problems are increasing. So what are mast cells? Mast cells release histamine in the body, um, and histamine is the thing that makes you flare, turn pinkish or reddish if your skin can show those kinds of running or show inflammation or swelling, can heat up a little bit, can show flushing, or feel flushing, and then it and so in a normal sort of system, mast cells work in everybody to do these types of things, and they're heavily involved in allergy and immunology and releasing these things in a normal process. But in people with mast cell disorders, they are pathological. And there are different types of mast cell disorders. I'm not going to get into the nitty gritty of everything, but they can get worse and worse over time and can get so serious that they can lead to things like anaphylaxis, which can cause death. And so a person really wants to make sure that they have these things monitored and under control. Um, and so, while some patients have true allergies with Ehlers-Danlos syndrome and hypermobility spectrum that are mediated by immunoglobulins, there's also a lot of people that have mast cell activation syndrome, and it can look an awful lot like allergies and even be diagnosed as allergies when it's not. And it can range a lot in severity and sometimes even be dismissed because they're not testing positively for allergies. Um, and it can be something, it can be mild as presenting as sort of like seasonal or year-round mild allergies, or it can be systemic and it can cause things in the skin and the GI tract, upper respiratory problems, problems with breathing, and problems even in the cardiovascular system in terms of releasing histamine whenever you have something hitting your blood vessels or things like that. And so really every person is different, and the symptoms can range from very mild and sprinkled around, just hitting like one or two systems, or it can be very globalized and possibly very severe in any range of those things. And so if you have irritation in your system and a tendency to have sort of this histamine type of reaction in your body, it's important to get it recognized and acknowledged early, because the earlier you get intervention, the better it can be. Also, mast cell disorders can highly interact with other disorders in the system. They can agitate people, like make their dysautonomia worse, they can make their skin issues worse, they can make their cardiovascular problems worse, and many other issues that can exacerbate and make worse. They can cause problems with your immune system, cause problems with healing. And so I would say this is a really important issue. Gastrointestinal issues and diet. So a lot of people with EDS report really all over the board different types of GI issues. And again, these can range from being incredibly mild to very severe. And sometimes people have been living with things for most of their lives. So what they think is normal may not be very normal, but they've just sort of learned to live with it. And but if you're wondering and you're having problems, I think it's really important because gastrointestinal issues can really affect nutrition and things related to diet, and so I think it's an important thing to address. And again, the GI tract, it's another soft tissue system with collagen. It's susceptible to similar types of soft tissue injuries as the rest of the body with Ehlers-Danlos syndrome. It also contains mast cells, as I mentioned earlier, and it's affected by the autonomic nervous system and how it works. So if you have those other disorders, you can also have GI problems, and sometimes it can be hard to distinguish, like, which thing is causing another thing, and on and on. And to make matters a little bit worse is it may not be that simple. Like, one thing may affect another and back and forth, and it may not be that one thing is causing another. And so, um, you know, mast cell problems may make your digestive problems a little bit worse, for example, or autonomic problems may make your digestive problems worse. But then if you start to developing problems with your nutrition, that may make you have problems in your GI tract that lead to problems in your system that make your mast cell problems worse and more irritable, or irritate your autonomic nervous system and make your autonomic problems worse, which then in turn affect your GI system, and so on. So patients can have, like I said, soft tissue injury in their GI system, like tears, ruptures, prolapse. They can have chronic inflammatory issues, things like eosinophilic esophagitis, colitis, irritable bowel syndrome. And they can have basic GI dysfunction, like motility issues, swallowing problems, or just other basic digestive problems. And so there's that, and then there's also that they have issues that, like, food intolerances, food allergies. They can have celiac disease, enzyme deficiencies, and that can cause problems as well. And so sometimes it can mean that diet-wise, if they have some of these kinds of problems, they may need to, they may have difficulty processing certain types of food, and it may mean having a limited diet, and some of the issues that they have may cross-react with one another, and it may make figuring out a diet really complicated for patients with these conditions. And so it can be very frustrating sometimes for patients with EDS. So, and then when there's other comorbidities, like some of those listed previously, like for example, patients with mast cell activation syndrome, they may have problems with, that, like having high histamine foods or stuff like that. So foods that maybe wouldn't normally irritate their GI tract might irritate them due to their GI, like their different histamine issues, and so then they have that added in as a factor, and they can still have food allergies and everything like that. And another thing that's sort of interesting in this is that it's not easy to just spot a patient with EDS and say that person's having a problem and that person isn't, based on any outward feature, and that is why we often talk about EDS as being a largely invisible condition. And it's because it's interesting. Patients can be underweight, they can be of normal weight, they can be overweight or extremely overweight, and they can still be having like very similar types of GI conditions. You can be very overweight and be malnourished and stuff like that, and it's really complicated for some people, and it can be difficult to figure out. And some people can have very similar genetic conditions that they find out, and the way that their bodies react to them can be very different. Some people can have constipation, some people can have diarrhea, some people can have sort of IBS where they're fluctuating with symptoms, and so the symptoms alone do not always give you a great clue of what's happening. They can sometimes give some clues, but you may need expert advice on this. And there are a lot of fad diets out there and stuff like that. And there may be some things that sometimes can help people a little bit here and there in terms of trying to figure things out. I mean, there's some things that are, I think, okay advice for a lot of people, like, for example, not eating a ton of sugar all the time is probably not bad advice, or not eating fast food all the time. But you know what? Nothing is ever that straightforward or 100% for everyone. I have seen sometimes where patients have gotten, like, their body weight has gotten so low that they really need to do anything they can to put on some weight, and for them, whatever it takes. And so, like I said, every patient's unique, and there are some diets that some patients follow and swear by, but I think that for this one, like, not going to recommend a specific diet, because I think that each patient needs to find their own path for well-being. But it's just good to be aware that these complications are very problematic when they happen. They can be very frustrating, because just when you think you have one thing figured out, another thing can come up, and you can be dismissed and treated like there's nothing wrong with you, or that it's all in your head. Or I've seen a lot of people labeled as picky eaters when they're not. They're really suffering from really severe symptoms. And so I think that these things are really important in terms of ensuring that you're getting the nutrition that you need to heal. So that is the issue of GI and diet. So those are the first 5.